am Dr. Rosiane Roeder, a board-certified plastic surgeon.
And I'm Andrea Sparr. I am a board-certified physician assistant, and I work in dermatology.
And we are the Rejuvaness Podcast, where we talk about skin and surgery completely unfiltered. Oh my God, it's our first episode.
Yes.
We're so excited. We've been planning this for quite a bit. Andy and I both work in the same practice, and Andy's just amazing. I love that she's doing this with me. She's been growing within our practice for a really long time. So I want her to go ahead and tell us a little bit about herself and what brought her here. And you guys, I think, are going to find out why she's so special.
Oh, thank you, Rosie. It has been a haul to get here. I literally joined this practice in 2010, working for one of the founding owner, Dr. Ness, that started the practice. And I was his surgical tech. So that means I got to work the floor. I got to work in all the OR with him. And he was just a wonderful mentor to kind of get me to where I am today. About 10 years or so into it, I felt like I wanted to do more for my patients. I've seen the back side, the front side. I wanted to be in the middle with everybody. So I decided to actually go back to school to get my bachelor's to pursue going back to PA school at some point. And I finally did it. Here I am. And I actually came back to the same practice that I plan on hopefully retiring at. But in 2023 as a PA on the dermatology side. So I've seen it all.
I know, this is so amazing because one of the things that I love about people is when they find a passion and they want to better themselves.
Right.
And Andrea here is going to be very humble, but she actually went to Yale, guys. I mean, we have an Ivy Leaguer amongst us, which is so awesome. She is from North Carolina, right?
South Carolina. Right over the line, right in Gaffney.
And she's been working with us for a really long time. We're at Piedmont Plastic Surgery and Dermatology. Piedmont was my first job out of residency. I was originally born in Brazil, and I moved to the United States the first time when I was 9 years old. I moved to Pennsylvania. My dad worked for Johnson & Johnson. It was a very fun and interesting move for us. Very culturally different, but amazing. After a year and a half, we went back to Brazil. And then at 17, I moved to Florida. I came to college in North Carolina. So I graduated from UNC Charlotte after I did my medical school and residency training in general surgery in Miami and then plastic surgery in Boston. When I was looking to find a job, I wanted to come back here. I always had a love for North Carolina, love for the state, lots of friends around this area, and it was just kind of homely.
Yeah, it's definitely crazy weather down here, though. I always joke with my patients and say nobody retires and moves up north, but we're one of the few states that have 5 seasons in a week. So your skin takes a toll.
It does. It is very different having experienced Miami life and then going to Boston, completely different climates, fighting that middle zone. But it's April. Our first recording is in April. And it's literally the second winter, right? This week has been freezing, hence sweaters and leather, even though we really should be going into spring.
Yeah, and flowers are blooming on the back end, so it's kind of crazy.
Yes, I literally got a text from my boyfriend saying, take your Zyrtec before you go there so your eyes are not red from the allergies. But this is what we're going to do in this podcast. We're going to talk about skin. We're going to talk about your beauty regimens. We're going to talk about plastic surgery and how we perceive ourselves as giving you some insight into what we experienced on our end. We, I think, have both been patients on the dermatology and the plastic surgery realm. So we understand what it feels like to be that. And we're also delivering care all the time. And we want this to be very genuine. We want people to get information that is unbiased, information that is true and real. So at times it might get serious and emotional, and at times it might get a little funny. But hopefully everyone will get something out of this that will listen to this podcast and will get to know us a little bit better and why you should come see us and come to our practice because we
trust us with your skin.
Yeah, exactly. Because we're surrounded by a bunch of fabulous doctors, PAs, and nurses. And I think it's unique also that Andrea has come through the ranks so she can really understand the patient experience and also the provider experience. So it's unique.
Best of both worlds, honestly. And, we're going to sit here and we're going to hit hard on these skincare myths that people are getting off TikTok and try and, steer them in the right direction.
Yeah. I think dispelling a lot of misconceptions. So what I see in the plastic surgery world is that people just get Instagram famous as providers. And then they are charging ridiculous amounts of money for procedures that most of us do for 10 times less. Not that they're not valuable, let's say doctors or surgeons in their realm, and a lot of them are in the forefront of new technology, which is admirable. But we are in a different area of the country.
Yeah.
We are in a place where it probably would be absurd to charge $250,000 for a facial aesthetic procedure. But you can get really great plastic surgery. You can get really great aesthetic treatments without having to spend
an arm and a leg and break the bank.
I mean, yeah. I mean, I think there are definitely some value to a lot of those things that you see on Instagram, but we want you to know that you can have expertise locally and that you have a wealth of well-trained
correct
doctors, surgeons, PAs in our area that are going to give you top-notch care.
Yeah, and we're always here to help. I mean, I'd give as much skin education I can to my patients. I even help them, with affordability. If it can't be done in the office, I try and give them little over-the-counter skincare hacks that can help some. It may not help 100% because it's not prescription medicine, but, we got to do what we can do for our patients. We have that responsibility to our patients to help them any way we can.
Yeah, I do think my esthetician's not super happy with me all the time because I give a scar tip sheet that says what you can buy at CVS, Walmart, or Target, but it's just a reality that sometimes we don't need all of that. And we can talk about healing, and we can talk about all what the natural things are to expect.
Right.
We want patients to come to a dermatology office, to come to a plastic surgery office, understanding what is possible. And if you see an Instagram post and when you look at it before and after, right, those things are not made overnight. There is a process that goes into that. So we're going to talk about that process.
Yeah. And then being realistic with our patients, because some of those are altered online that you're seeing. Some of those are at different angles. These people are in different clothing. You can see differences in the pictures as a provider versus a patient. You just see the change, but we see the change that they're making you see. So we just want to be able to actually, like I said, break those myths and show you what you can actually have done.
There is this one guy out of Brazil, and I follow his Instagram. One of the things that I do love about him is that he will be very honest about the fact that it takes at least 3 or 4 sessions to get to this result, how much filler he's doing on the facial harmonization. It's a lot of syringes.
Yeah.
I was actually really surprised. And I have patients that come to me thinking they're going to get that in one sitting. And I'm very conservative in the way that I approach things and how we build up so that we don't lose your normal face and your aesthetic, and that we build slowly. So I like when I see that. And I want to talk to people honestly about the fact that those people out there that are telling you exactly what they're doing, how long it's taking you to go there, maybe showing those intermediate pictures.
Right.
Those are good people to follow. And I actually have been accused of altering pictures.
Really?
Yes. And I didn't. So I do understand that it's not an exact science.
Right.
In my practice, I rely on my patient care coordinators to take a lot of my before and after pictures. We have a room. It's kind of set the same way, but the camera angles sometimes change. They zoom in and zoom out.
Right.
It's amazing how much it takes an effort to get really consistent before and after. So yeah, the lighting might be off a little bit. So I try to say, those things. So I get it, how sometimes it might look totally altered. But it's, I think, nice to give a little bit of the knowledge of what happened in the process. Because instead of just seeing snapshots in time. And we're not just going to talk about aesthetic either, because I do a lot of reconstruction.
Right.
And Andy does a lot of medical dermatology treatments too. And it's just important to highlight that I think we're both better.
Right.
Because we're in both realms.
Correct. And I cross both realms because I've worked on the plastic side and the dermatology side. So it's nice to have somebody to actually conversate with that knows a little bit of background on everything else too. And then speaking of being conservative, I fully believe that conservative's the way to go. That's the big thing out there now. People want surgery without looking like they had surgery. And even cosmetics, fillers, Botox, they want to look natural, but they want to look younger.
Yeah. You just want to look like the better version of yourself.
Right.
And I do welcome patients that bring me wish pictures. And then I try to say realistically, is this achievable for you or not, right? Because we're all very different. So if you are petite like me, 5 feet tall, and you bring me a picture of a 6-foot model, right? It's going to be a little bit different. But if you bring me somebody that's similar in size and shape, then we can talk about how things fit you in a realistic realm. When it comes to facial aesthetics, which I also do a lot of, I always ask about what are their goals? What are the things on their face? We look at mirrors together. I have them point out to me. One of the hardest questions, at least for me, is when people come and tell me, Doc, what do I need?
Right.
Right? Andy, what do I need?
It's whatever you want, but we got to be realistic about what you want. And that's just kind of what I have to say to my patients. I'm like, you tell me what your goals are, and I'll tell you what we can do to get as close to them as possible. But I'm also not afraid to say no to my patients, because if there's something that's not going to work well for them, I will say no, because they will regret it in the long run.
Yeah, I think that's really true. When I see doctors trying to tailor to patients' wishes that are not within the realm of reality, then I think they're doing a person a disservice.
Right.
It happens a lot. People come in with an idea in mind, but then I have to tell them, like, to get you there, these are the steps. And sometimes I have at times let go of patients that I didn't think we were on the same wavelength. Like you said, the saying no. It's important. If somebody's telling you no, there's a reason why. And you maybe will find a better fit somewhere else. I definitely am not scared of doing that.
Right.
I just feel and know what can work well in my hands. And if I don't think I can deliver that result, then I will send someone to another surgeon or another cosmetic dermatologist, another great injector that will be able to get them what they want. Not all of us have the same aesthetics. I'm sure that if Andy and I look at the same person, we might see different things.
Right.
Right? And for me, it's important for that person to tell me, look, my eyes bother me or my lips bother me. And then I can tell them, this is what I think we can do to get you there.
Right. And then if I can't do it, I honestly am like, the best bang for your buck would probably be to have some type of plastic surgery. And I always try and get them set up with one of the plastic surgeons, because at that point, it's out of my realm, right?
Yeah.
But definitely, best bang for their buck is what I try to explain to them. If you're going to get this done today, this is what you're going to see. But longevity, spending that money every 3-6 months, you'd be worth it getting a lower bleph or a facelift and something like that.
I told Andy earlier that I have this analogy I give all my patients when it comes to facial aesthetics. I tell them that their face is like a bed, that your bone structure is like the bed frame. And then you have your subcutaneous tissues and muscles, which are the mattress. And then your skin is the bedspread. And honestly, nobody cares what you've done to your mattress or bed frame or how much money you've thrown on there.
Yep.
If your bedspread is wrinkled, right?
That's what they're going to see.
That's what they're going to see.
And that's all they see.
Yeah. So the basics to me of facial aesthetics starts with your skincare routine, which Andy is going to tell us a lot about in the future episodes. And we're going to go into details of what she uses, because everybody tells her skin is amazing, which it is. It's glowing. Patients ask me where my regimens are. So we'll go over some of that stuff in our future episodes.
And we'll give you the dirty deets of like what we actually feel like over the counter is worth it, what prescription medications, actual prescription products are worth it, our medical grade products. But again, like I said, our goal is just to give you the best bang for your buck that's actually going to do something for you.
Yeah. And we'll go down all those bedspread, like all the bed layers, right? And tell you what can affect each one of them, because that's what you want. And that's why my consultations actually take a little bit of time. I do take 30 minutes to do a facial aesthetic consultation for any injectable patients that come, because I want to look at faces together. We even have a 3D modeling machine that I can take your picture and mirror what it would be like if your whole face was like the right side of your face or your whole face was like the left side of your face. It's very awesome. If you haven't done that, you should do it.
Now, is that the Vectra?
The Vectra, yeah. Because we're all asymmetrical.
Right. And I don't think people understand that. But when you definitely look in the mirror, one side's going to be different than the other regardless. And then people try and get more asymmetry. But I think once they truly see what one side matches the other, they don't like it.
Right. Asymmetries are like normal. And our eyes drift sometimes to perfect lines. It's amazing that one of the techniques in plastic surgery to correct a visible scar is to make it more jagged.
Right.
Right? Is to like see it or reorient it in a different way than what our eyes are going to pick up. You know, so we pick up these weird symmetries. There's a lot of research that says that the most beautiful faces have certain harmonizations to them.
Right.
But if we really did make you look exactly like you do on just one side, I don't think it would be more like robot look like.
And I tell my patients, I'm like, you are your own worst critic. You see yourself every day. You're that one in that mirror. So like for me, I take pictures of my patients on day 1. I see most of them back in 12 weeks because that's usually how long it takes to see change. And they are blown away by the change from day 1 to day 90 because they've been looking in the mirror every day and they only see that small change.
Yes. And even though I won't put necessarily all the stages of before and after in a book, for example, or put them out on the internet all the time, it's really important on the journey of a plastic surgery patient to have those landmarks. What do you look like post-operative day 1? What do you look like a month after surgery, 3 months, 6 months? Because we see ourselves every day, we don't notice those small changes.
Right.
And it's critical because our eyes play trick on us. And when you start a, let's say, skincare regimen, it takes at least those 6, 8 weeks for you to be able to see any kind of change. And I will guarantee you that somebody else will see those changes in you before you see it on yourself.
Right. And I'm like, your mom will probably see it, your sister will probably see it, your husband will probably see it, but you, like I said, you are your own worst critic.
Yes, we are all our worst critics. And as women especially, right?
Correct.
And now with the advent of selfies, cell phones, Zoom meetings.
Filters.
TikTok. I looked at a filter of myself earlier and I was like, now I know what people are talking about.
Right.
But it's not what I think most people are really expecting. And it's interesting because although people say they want to look natural, some people don't. And that's okay too. Like I sometimes have patients that tell me, I want to look like I bought my breasts. I'm like, okay. It's about you.
Yes,
it's about
it is.
what makes you be confident. It's about what makes you feel like you are portraying the image that is in tune with who you are.
Right.
And my job is just to facilitate that. Now, if it goes beyond the point where I think it's not medically safe, or it's not in your best interest, or we identify other things like maybe body dysmorphic disorder, or some other depression characteristics, or somebody's trying to fit the model of somebody else, right? Because sometimes patients will come in because they want to meet their partner's expectations or something like that. Then, those are a little bit of red flags. And
you can always notice those patients because they look at their spouse for everything that you're talking to them about because they're waiting for them to answer to see what they truly want and not what the patient wants.
Yeah. And I love when my patients have amazing partners that are supportive of them.
You got to have the support.
Yeah. They're all about making sure that their partners want to be confident. I have a lot of patients who are couples. I had one of my patients had a facelift and then her husband's like, I cannot walk around with this younger woman looking like I'm her dad. So I did his facelift or neck lift too. So, I think it's awesome. And when people can go through a journey together.
And fair's fair. He's got to take care of her. She's got to take care of him.
And that's some of the best partnerships and they're awesome patients of mine. And I've had more than one couple come to me and have work done, which is great. If that's like a true partnership right there at times. And I think that's really nice. And I love that. But I've also had other things happen when people were coming in and they did not have supportive partners. And that was quite obvious. And sometimes we want to provide a safe space where patients can be who they are. And then if this is not necessarily what they truly want, you can tell. And
Right.
You can pull them apart and tease that out and try to encourage them and build their confidence. So it's a very interesting realm. Like, I have a love-hate relationship sometimes with plastic surgery, because I feel like I do this because I want to empower women to be, and men as well, to be their best selves and to have confidence. I grew up not necessarily always loving my body and not feeling confident in who I am. So I can relate to that as well.
Mm-hmm.
But I think it's an environment where you have to be really, truly responsible to deliver that kind of care, because this is all elective care.
It is.
Right.
And like I said, you give them a disservice if you aren't.
Right. If you're not really doing things that are safe, if you're pushing the envelope in a way that's sort of kamikaze, if you're making people look like characters of themselves, if that's not what they want. I hear a lot of my female patients come and tell me, can you downsize me? Can you remove implants? Can you change this? Because the other person that did my first surgery, and I do a lot of revisions now, my first surgery didn't listen to me.
Right.
They just told me that this is the size that I needed. They just told me that this is what I needed to have done, and they didn't listen to my concerns.
And they only gave them one option.
They only gave them one option. So I feel like that is like my special sauce in a way,
Right.
is trying to listen to what people really want and making sure they get that. And it's really sad to me that there might be people still out there that feel like they know better than their patients.
Right.
So many times I think it's something when I go into the room, and then once the patient tells me what they're feeling,
Right.
what they're looking for, something changes in my mind, and I say, okay, like, I got to listen to this person, right? I gotta find out or do a deep dive, onto really what is it that they want, what is causing this problem, how can I solve it? And I never put myself in a situation where I can't solve a problem either. And I think that that's something that we are both very
good at,
is like understanding that we're delivering a service that we can take care of the complication. If you're going to someone who is only going to do like an injection,
Mm-hmm.
or is going to do a surgery, but doesn't have the capability of doing or dealing with the complication of that,
Right.
then they probably shouldn't be doing it.
Correct. And then, like I tell my patients, you have to be your own best advocate for a lot of things. We listen. Not all providers listen. And I think that's a good trait that we both have, is we try and give back to the patients exactly what they're asking for, but safely.
Yeah. And just because there's a Groupon for it doesn't mean that you have to be treated like a patient who is seeking a cheap service.
Right.
Just be aware of the fact that you can't trivialize something that's purely elective and aesthetic. It's your face, it's your body. Really do the deep dive research into who is doing this to you and what their motivations are.
And what their background is to be able to do it.
Yes. And I think that's what we're going to break down in a lot of our other episodes. We're going to talk about, how do you find out somebody's credentials?
Mm-hmm.
How do you go about choosing a plastic surgeon? How do you go about choosing a dermatologist? How do you go about choosing a practice? What are important things to look for? And we're going to dive into some other medical aspects of our practice too. Andy does a lot of medical dermatology, and I have a passion for breast reconstruction, and we might do a whole episode on just that.
Yeah.
So we look forward to kind of bringing a lot of this information out to you.
And we just want to thank y'all, our listeners, for joining us for our very first episode of Rejuvaness, because it took a while to get here. We're so happy to have you listening. Share it with all your friends, and we can't wait to bring you the next show.
Yeah, definitely comment on things that you might want to hear us talk about in our next episodes. That's important to us because we want to serve our community. We want to serve our patients. If there's anything that's a particular interest, or if we didn't address something fully, please comment, and we'll be happy to do little clips about it, or even do a whole episode if it warrants it.
All right.
All right. Well, see you guys for episode
Number 2.
number 2.
All right.
All right. See you soon.